Okay, so this would be a patient for foot, ankle, or knee pain. If you kind of localize it to the knee, I would look at kind of internal and external rotation of his hip. So again, he doesn't really want to internally rotate. Externally rotate, he does pretty well. Getting a little bit better with internal rotation. Externally rotation, he's pretty free. Why don't you lean up for me, and then swing your legs this way. She can stay there. Okay, and then I would go ahead and check motor. So go ahead and swing your leg out like you're trying to kick me. Do it on this guy, and then pull this leg back towards the bed. There you go. Do the same thing here. Okay, now lift this foot like you're taking your foot off the gas. All right, like you're pressing the gas. Alrighty. Okay. And then the other thing I can check for is whether he internally and externally rotates. So kind of taking the tibia. Doesn't really like internal rotation, but he's okay with external rotation. So that internal rotation is really not great. And then this guy, internal, he's not really moving. But if I externally rotate him, he's okay. The other thing I could check for is the fibular head. Just pull it anteriorly, push it posteriorly. He's moving posterior, but he doesn't like anterior. Do it on this side as well. Let's kind of get that fibular head, kind of pull it anteriorly, push it posteriorly. Okay. So for him, I think his biggest problem would be his internal rotation on this side. So I would fix it with muscle energy. So he's externally rotated for the diagnosis. I'd put him in internal rotation, have him go rotate out. Yes, I'd have him rotate out, hold it for a couple seconds, release it, and then do that 3 to 5 times. I would tell him that I'm going to use his muscles in the way that he wants to go to make him relieve his restriction, and then I'd reassess the same way. I would go like this, and go like this to see if he externally rotates, and hopefully that leg would be corrected in internal rotation.